Thank you, Doctor, for joining us in this case study video series, an educational initiative by Himalaya Baby Care. As India's #1 doctor-prescribed baby care brand, we strive to uphold the highest standards in every step of our journey. This case study, Unexplained Fever and Behavioral Changes in a Child, a hidden case of bullying, addresses a critical aspect of pediatric care for all-around development, physically, mentally, and emotionally. It highlights the need for careful evaluation and timely diagnosis to ensure the best outcomes for children for a brighter future. We are honored to have Dr. Arun Jain, consultant pediatrician at Dr. Arun Child Hospital, Shahganj, Agra, with us. Dr. Jain will share his expertise and valuable insights from a unique case, highlighting innovative approaches in pediatric care. Let's begin this enlightening session.
Namaskar, myself Dr. Arun Jain, Director and Consultant Pediatrician at Dr. Arun Child Hospital, Agra. Today I will be sharing a compelling pediatric case that highlights how psychosocial factors such as bullying can manifest as persistent physical symptoms in children. We often focus on medical causes in a clinical setting, but this case emphasizes the importance of delving deeper when routine treatment fails. This is a case of a 6-year-old boy with recurrent fever, emotional disturbance, and academic decline, ultimately linked to a hidden psychological stressor. A 6-year-old boy was brought in a 1-month history of fever that appeared intermittently and did not respond to standard treatments. His parents also reported a noticeable deterioration in his academic performance. The child increasingly feared attending school and exhibited a significant behavioral change. He often seemed anxious, had difficult sleeping, and no longer took interest in activities he previously enjoyed. There were no known prior illness or developmental concern. On examination, no abnormalities were detected. The child's vitals were stable and there were no signs of infection, inflammation, or any systemic illness. Overall, the physical findings were unremarkable, which made the prolonged fever and emotional symptoms puzzling and suggest the need for a more detailed psychological and environmental history. The absence of clinical signs posed a diagnostic challenge. However, the child's emotional state and fear of school pointed towards a possible psychosocial issue. During a gentle and confidential conversation, the child revealed that he is being bullied at school. He described incidents of being beaten, verbally abused, locked in the bathroom, and threatened not to disclose these acts. His emotional trauma was likely the root cause of his fever and behavioral regression. Based on the child's history and emotional profile, a diagnosis of psychosomatic symptoms secondary to school bullying was made. There was no underlying infectious or organic pathology. Instead, the physical symptoms were a manifestation of severe psychological stress caused by repeated bullying. The treatment approach focused on psychological support. Both the child and his parents received counseling to process the trauma. The matter was reported to school authorities and the offending student was expelled. Continued follow-up ensured that the child's emotional recovery was monitored and his reintegration into the school environment was handled with care and support. Over the next few weeks, the child showed significant improvement. His confidence gradually returned, his fear of school subsided, and he resumed his academic activities with growing enthusiasm. The fever episodes resolved completely and his sleep and behavior normalized. His parents also reported that he again engaged in hobbies and social interactions. This case reminds us that not all symptoms in children have a physical origin. Persistent fever, behavioral changes, or school avoidance should prompt a careful psychosocial assessment. Bullying remains an underreported issue in many communities. As pediatricians, we must be sensitive to subtle emotional cues and create a safe environment for children to speak freely. A detailed history and empathetic approach are crucial to uncovering such hidden causes. In conclusion, this case of a young boy suffering silently due to bullying reinforces the value of looking beyond clinical symptoms. Emotional distress can present as physical illness, and a high index of suspicion is necessary to identify such issues. By combining carefully history taking with psychological insight, we can provide truly holistic care to our young patients. धन्यवाद.
We hope you enjoyed this session and found it insightful and impactful. Thank you. Himalaya Baby Care proudly launches pure cow ghee range with pH 5.5, specially formulated for baby's sensitive skin from day one, that promotes skin immunity, offers an anti-inflammatory effect, protects the skin's microbiome, provides intense moisture, deep hydration and nourishment, formulated with pH 5.5. Looking forward to your valuable prescription support for Himalaya Baby Care Pure Cow Ghee range.